We usually picture the damage we can see on the skin. But the real medical drama, the true crisis, it happens deep inside the body. It affects pretty much every single organ. And that's exactly what we're going to break down today.
Okay, so let's start with the absolute basics. What even is a burn? Well, it's a tissue injury from some kind of extreme energy, and the result is this really specific thing called coagulative necrosis. The best way to picture it? Think about what happens when you cook an egg. The heat makes all the liquidy proteins in the egg white turn solid, right? That's basically what happens to your cells. They die, but they hold their shape for a little while. So here's our game plan. We're going to start with that cellular story, then we'll look at how burns are classified. After that, we'll dive into the body-wide crisis a bad burn can cause, check out the crucial math that saves lives in the ER, and finally, touch on the long road to recovery. All right, let's start small. I mean, really small, at the micro level, to get a handle on what's happening to the body's fundamental building blocks.
And what's really fascinating is that this process, this coagulative necrosis, it's not just for burns. It's the exact same thing that happens to heart muscle during a heart attack, or to kidney tissue when its blood supply gets cut off. It's one of the body's core responses to a major catastrophic injury.
Okay, so let's zoom out from the tiny cell to the skin itself. We're going to look at how doctors classify just how bad the damage is, because that classification is absolutely key to figuring out the right treatment. First up, we've got the one we're probably all familiar with, the first-degree burn. Seriously, if you've ever had a really nasty sunburn, you've had one of these.
The injury here is totally superficial. It's just on the surface. You get that redness, it might be a little shiny, it's definitely tender, but all of that damage is contained right there in the epidermis, the skin's outermost layer.
Now, things start to get a lot more complicated when we go deeper. Second-degree burns actually punch through into the next layer, the dermis. And believe it or not, they're split into two different types.
First, you've got your superficial partial thickness burn. This one hits that upper part of the dermis, and because all the nerve endings there are now exposed and super irritated, these burns hurt a lot. This is also where you get those characteristic blisters. But then there's the deep partial thickness burn, and this one's different. Here, the damage goes through the entire dermis. It wipes out sweat glands, hair follicles, and, get this, the nerve endings. So weirdly enough, this deeper burn can actually be less painful, and the skin looks totally different, more dry and leathery instead of pink and moist. And that brings us to the most severe category, the third-degree or full-thickness burn. This is where the damage is just catastrophic.
With a third-degree burn, we're talking about destruction through all the layers of the skin, right down into the subcutaneous fat underneath. There's no sensation left at all, the area gets hard, and these injuries almost always mean major surgery and skin grafts are needed to heal. Now, this is the most important takeaway. With those severe second and third-degree burns, we're not just talking about a skin problem anymore. No way. The injury kicks off this massive body-wide inflammatory response that can spiral into a life-threatening crisis in no time. So what does that look like? Well, for starters, a major burn makes the body lose a massive amount of fluid. That means blood flow to all the internal organs plummets. In the gut, this can cause a very specific kind of stress ulcer in the duodenum called a curling ulcer. It's a direct result of the trauma from the burn. And the kidneys? Oh, they are under incredible stress. The body's losing fluid, so urine output drops. The body freaks out and releases hormones to try and jack up blood pressure, but this whole chain reaction puts this immense strain on the kidneys, and it can quickly lead to acute kidney failure. So to stop this terrifying domino effect and pull a patient back from the edge, ER teams have to move incredibly fast. And to do that, they rely on some surprisingly simple but totally life-saving math. It all starts with this clever little trick called the rule of nines. It's a way to quickly estimate what percentage of the body has been burned. The adult body is divided into sections of 9%, or multiples of 9. So an entire arm is 9%, a whole leg is 18%, and so on. It gives them a crucial number in just a few seconds. And that percentage they just calculated, it is absolutely critical, because it gets plugged directly into one of the most important equations in all of emergency medicine, the Parkland formula.
The Parkland formula is the recipe for saving a life. It tells the team exactly how much IV fluid a patient needs over the next 24 hours to fight off shock and stop the organs from failing. You take 4 milliliters, you multiply it by that burn percentage, and you multiply that by the patient's weight in kilos.
So, for a 70-kilogram person with a 20% burn, that's 5,600 mLs, or 5.6 liters of fluid. And here's the kicker. Half of that, 2.8 liters, has to go in within the first 8 hours. The rest is given over the next 16. It's that precise.
Okay, so once the patient is stabilized and that initial crisis is averted, the focus shifts. Now begins the long, difficult journey of actually managing the wound itself and helping the body heal. Right away, the biggest goals are to stop infection before it starts and to manage the patient's pain. That means antibacterial dressings are essential, and topical antibiotics are a first line of defense. Pain control has to be tailored to the burn depth. We're talking NSAIDs for the more superficial burns, but powerful opioids for the deeper, more agonizing ones. So from the microscopic death of a single cell to the body-wide shock that threatens everything, it's pretty clear that a burn is so much more than just skin deep. And from the rigid math of the Parkland formula to the delicate art of wound care, treating these injuries demands this incredible balance of hard science